dial-a-flow. When preparing to administer your medication by dial-a-flow, begin by following the principles of good technique. Assemble your supplies and medication. You will need gloves, alcohol swabs, 2 pre-filled saline syringes, 1 pre-filled heparin syringe, bag of medication, dial-a-flow IV tubing. Take a moment and read the label on the medication bag to make sure your name appears and the medication is not expired. Now you're ready to get started. Prepare your work surface. Remove the outer wrapper from the saline and heparin syringes. Tap the syringe to get the air to rise to the top. Then, to remove the air, pull back on the plunger slightly and then push the plunger until liquid appears at the top of the syringe. Remove the outer wrapper from the dial-a-flow. Put on gloves. Remove the cover on the spike end of the dial-a-flow tubing. Be careful not to touch this area once the cover is removed. Remove the cover on the tubing port of your medication bag. Be careful not to touch this area once the cover is removed. Using a twisting motion, insert the spike into the port of the medication bag. Close the clamp on the IV tubing. Suspend the bag on your IV pole. Squeeze the drip chamber once prior to priming. This is very important. Open the tubing clamp and allow the fluid to fill the tubing. A small drop should come out of the end of the tubing. Close the clamp once this happens. Scrub the end of the connector with an alcohol swab for 15 to 30 seconds. Attach a normal saline syringe by pushing and twisting the syringe onto the connector. Push on the plunger using a start-stop method to flush your IV. Untwist and discard the empty syringe. Do not touch the end of the connector. If you do, wipe again with a new alcohol swab. Remove the cap from the medication tubing and push and twist onto the connector. Adjust the dial-a-flow to the prescribed rate. Open the tubing clamp. When complete, close the clamp on the tubing. Remove the tubing from your connector. Cover the tubing end with the provided cap if it is to be used for a second dose. Attach a normal saline syringe by pushing and twisting the syringe onto the connector. Push on the plunger using a start-stop method to flush your IV. Untwist and discard the empty syringe. Attach a heparin syringe by pushing and twisting the syringe onto the connector. Push on the plunger using a start-stop method to flush your IV. Untwist and discard the empty syringe. Dispose of your used supplies. Remove your gloves and wash your hands. The IV tubing is good for 24 hours. With each dose, you will feel more confident. Should you have any questions, contact your Vital Care Pharmacy representative.